Welcome back, Source Nation. You're listening live to Healthy Living with Dr. Julissa.
Good evening, Source Nation, and welcome to SRN Live Television. I am your host,
Kathy B, and you're live right here on Healthy Living with Dr. Julissa-Hernandez. Now, tonight's conversation is a timely conversation, Source Nation, because we're going to be speaking on in vitro and understanding the naturopathic way to infertility. Now, you guys know what time it is. That's right, Dr. Julissa-Hernandez is here in the studio with us, and I am so excited to bring her in, and we're going to have a dynamic conversation. I do believe that Dr. Julissa is here in the studio with me. Dr. Julissa, hello and welcome to Healthy Living. How are you this evening?
I'm feeling divine to be here with you once again, my dear friend. Feeling divine. Thank you for having me.
Well, I'm excited to have you. You know, tonight's conversation is a timely conversation. We're going to be speaking on in vitro. And the reason why I really want to discuss this topic, Dr. Julissa, I actually had a young lady reach out to me in reference to infertility. Now, she is a 33-year-old woman, soon to be 34 years old. And she is in her career. She's been working very hard, but yet she realizes that she wants to have a family right now. She mentioned to me, she said that this is something that she has thought about in vitro and wanted to find out the pros and cons and really understanding if this is something that she should do or if there's something naturally that she could do in order to have children. Now, I don't believe that she's ready to be a mommy right now. She's just trying to get information. And when she's ready, she wants to make sure that she can conceive naturally and have the babies that she wants. So let's talk about that. What are your thoughts?
First, I commend her for thinking of these different ways to be able to make sure that she's going to be able to have that baby that she so desires. And she's thinking about this at a good time, not waiting till later in life when she struggle may be a bit more difficult. So in her 30s, I absolutely understand her concern there. I will be, in order to answer her questions, we'll be referencing my new book, The Naturopathic Approach to Fertility. So for those of you that have it, I will be referencing specifically the chapter titled Why Take the Naturopathic Approach to Fertility, and beginning on page 18. What I do share there is even a case study of just one of many patients that I've helped in my 23 years in practice in helping couples conceive, and that as of today, it's a blessing to have a 100% success rate in helping couples to achieve that baby that they so desire. So with the in vitro, the challenge lies in the drugs that she's going to have to inject and the risks that come about with, for example, miscarriage. So if I may, I'd love to share some of that research and insight there that may help her with her decision.
Okay, please do.
Okay, wonderful. So as far as an example of a patient that I treated, a patient by the name of Karen, who was also 33 years of age at the time, and she was also married. She did come to see me for a fertility consult on May 11th, 2011. She'd undergone two very expensive IVF procedures, and the challenge was that when she did her first procedure, it weakened her uterus to the point where she miscarried. Upon her second IVF procedure, she miscarried once again, and all of this causing much heartbreak, causing much stress and tension between her and her husband. So the challenge is that, first of all, a woman that has to go through the IVF has to use fertility stimulating medications. The side effects, the side effects alone from just the fertility stimulating medications involve challenges such as the bloating, cramping, painful breast tenderness, the persistent headaches and migraines, which sometimes are extremely debilitating. There's heavy vaginal bleeding that a woman has challenge with, a lot of pelvic pain that comes along also with doing the procedure leading to the IVF. They'll see blood in the urine, challenges with the urinary system to where they feel that it's a constant UTI as well. That was one of the symptoms that Karen, for example, had as well. Even if she's young, she'll start feeling hot flashes and mood swings because of the fertility medications. And then there's increased risk of fevers, 100.5 degrees to Fahrenheit or so. I would say that the biggest issue with the IVF treatments is that the birth success rate decreases with a woman's age and with each repeated IVF cycle that she does. So remember, for example, just that one patient of mine, because I do share a lot of patient stories here within my book so that women can relate, and men as well can relate to some of the challenges. So on top of that, to add to an expectant mother's heartache, the rate of miscarriage, just as Karen underwent. She underwent 2 miscarriages. The rate of miscarriage through IVF is 20 to 30% greater than pregnancy through natural conception.
Now I want to stop right there. It's very interesting. And let me ask you, the doctors that are performing the IVF, are they sharing with the women that are interested in this type of procedure that this could happen? That miscarriage could happen during the procedures? Talk to us about that.
Right, that's a great question, Kathy. What I can tell you is that if a woman or a couple asks that they want to know all of those side effects, they should be told of everything. All doctors are different. These are my colleagues as well, I will say, even though they are of the conventional medical field, very different from alternative medicine and naturopathic medicine. But I feel that both realms of medicine, in other words, should exist. But in certain procedures, definitely a naturopathic approach is the best way to go when you consider a lot of these detrimental side effects. We're talking about, just in the example of Karen, my patient, who at 33 underwent these challenges. The first IVF weakened her uterus so much that that's why she miscarried the first time. And then having the second IVF, miscarried again. And her husband, as they were sitting in my office, told me he did not want her to go through that again. Now, this beautiful couple, I must say, she was like the spitting image of Iman. They were a beautiful couple from South Africa. And just a few months later, she did conceive and had twins, one boy and one girl. Of my 23 years, though, please let me say this right now, it's the only couple that has ever had twins. So I cannot promise that. However, that was a blessing indeed.
Yes.
And so it was beautiful story to share within my book. And she's allowed me to share that story, and that's why she gave me permission to put her story in my book, and it was a great thing to share.
Indeed, a blessing. Now, let me ask you, in reference to in vitro, we understand that there are different cycles of treatment. How long are they actually in the process of trying to conceive? How many cycles of IVF would they normally have to go through?
It depends on the woman.
Really?
Depends on the couple. It depends on the couple. She was feeling absolutely weakened and in pain, and after those cycles, the husband was the one that said we need to consider a different approach, because he told me in the office, I do not want her going through that again. So the other challenge is that they have to use fertility stimulating hormones. And then in addition to these drugs and the side effects that I've just mentioned, that use of those medications can cause ovarian hyperstimulation syndrome, which will cause the ovaries to become very inflamed and painful. Okay, so these medications actually stimulate the ovaries to produce eggs. And however, it's difficult to say how much medication a woman actually may need. So they tend to over-medicate themselves constantly.
Okay.
And then too much medication is what leads to this OHSS, the ovarian hyperstimulation syndrome. And then it causes the ovaries, as I said, to become swollen, painful. And along with this, development, Some women notice extreme weight gain. So now, apart from that, she's feeling bad about herself, her self-image, and so on and so forth. There's abdominal pain, shortness of breath, and even vomiting. So all of this distressing, along with that, development of the OHSS because of stimulating medications that they have to use. So apart from, these distressing symptoms, IVF can cause decreased urination frequency. So she's retaining a lot of water.
Right.
The woman then also, with the process of IVF, will develop nausea or vomiting. Most times. They have feelings of dizziness, faintness, as I mentioned, the shortness of breath.
Okay.
They, with the weight gain, what they tend to gain is about 10 pounds or more, literally within 3 to 5 days. Within 3 to 5 days of beginning those sorts of medications. And then you have the additional risk of bleeding, infection, and damage to the bladder or even the bowel. That's from the IVF procedure itself. The next challenge: many forms of the assisted reproductive technology, ART as it's called, but specifically IVF in particular, women who finally do achieve conception, they face other increased risks. So again, there's the likelihood of miscarriage. I already mentioned that, and that's from Karen's story, and I shared that. They also may have multiple births with an increased risk of premature delivery. So now we're talking about low birth weight babies, all from the IVF, all these huge risks. So beyond the medical risks, all those complications, the process of investing all that money, I'll share that as well in a moment, time and the hope and conventional allopathic medical fertility treatments, it puts severe stresses on a couple's relationship and resources. If we go into, for example, what some of these procedures cost, many insurance plans, they don't really provide coverage.
That's right.
For medical allopathic fertility treatment, and IVF is very expensive. On average, nationally, a fresh IVF cycle tends to cost $12,000 before the medications.
Wow.
And this typically runs another $3,000 to $5,000 to include the medications that she's injecting into her fat deposits constantly, which is painful to have to inject herself every day and then see 10 pounds gained weight in about 3 to 5 days, all of these things, okay? So after all the suffering and the financial strain, IVF results in that surprising low rate of live births. The Lancet published a research study in which it stated that less than 14% of women who undergo IVF treatment achieve their dream of giving birth to a live baby. Less than 14%.
That's low.
Very.
Wow.
Very.
Great information, Dr. Julissa, you are sharing with us. Source Nation, you are listening and watching live right here on SRN Live Television. We are with Dr. Julissa Hernandez, and of course, I am your host, Kathy B. We are speaking tonight on IVF. Women are now considering IVF to have children, and Dr. Julissa is giving us some very good information in reference to that. Now, Dr. Julissa, we talked about cost of IVF, and you mentioned that really there's could be up towards 12,000 and then maybe 3,000 once you include the medication. I talked about women, once they are actually injecting themselves, they're gaining weight. Some have had the unfortunate loss of a baby, so miscarriage can happen during the process also. I want to move on, if we can, and just talk about the mental state. Of course, I conceived naturally. I had both my children naturally, and I didn't have to use any type of fertility drugs or medicine to have them. But the mental state, you shared with Karen's story and her husband, and he said that he didn't want to see her go through that. Talk to us a little bit about what you experienced with Karen and her husband, and maybe other couples that have tried IVF and weren't successful. Talk to us about the mental state.
With much of the patients that I've received, it's been where it either didn't take, the
Okay.
IVF didn't take, or they had that loss of the miscarriage.
Okay.
So by the time they come to me, which every patient that has come to me for fertility pretty much has been that they've gone another route and I'm the last resort, their last hope, in other words, because they've tried other avenues. You find them just looking and scraping for that hope. There's the distress, the sadness that they come in with when they start sharing their stories, because my first thing is, please tell me your story.
Mm-hmm.
And I need to let them share and open up some of those wounds, unfortunately, so that I could understand how to further help them. So that's the challenge there, with that desperation as well, and that severe desire of wanting this family to be with the person that they love. So that's really what I've encountered the most. But I do everything in my power to make them see that there is hope. If I've been able to help so many in the past, I don't quit until I make sure that you get pregnant. That's what I say. I'm here to make sure you get pregnant. Right. I don't leave them until they do. Yeah. And so that's where it lies. The journey is a beautiful one.
It is.
Yes, because it's one, bringing them closer together. All of these things that come into play sometimes could be even an emotional buried root cause that's preventing her body from really taking on and having the house ready for baby, having the womb ready for baby. So I discuss all of that also within my book. I touch upon the emotions that tend to affect fertility and all of that. Oh yeah, all of that comes into play.
Love that. And if you will, share with Source Nation, what do you actually do when the couples are in your office and they have stated that they've tried IVF, this has not worked? If you will, share some of the steps that you take the couples through in order for them to achieve a successful birth.
Wonderful question, because it's not just helping a woman get pregnant or helping that couple get pregnant, it's making sure that that pregnancy goes full term as well.
Right.
Wonderful. Exactly. Wonderfully put. So in my consult examination of the two of them and in a naturopathic medical approach, of course, I'm a holistic iridologist, so I focus on seeing imbalances within the body through the iris of the eye. And so as they share with me their story, it could be anything from she has blocked tubes, or she only has one fallopian tube and had to have one removed, or he had low sperm count, and so on and so forth. Many different challenges. So in that, I have to then bring together an herbal therapy program to focus on what their specific challenge is. If I'm dealing with a man with a low sperm count, we need to double that in 30 to 45 days. If I'm dealing with a man that has abnormally formed sperm, I need to bring in natural therapies that make sure that there's an oval shaped head, to make sure that there's a tail, to make sure that the tail's not crooked, because all of those factors can cause her to reject the sperm. Okay. So there are many factors there, and I discuss that in the chapter on men's health. With the woman, it could be anything from weakened uterine walls. Why she went through the IVF and is now coming to me, and she had 2 miscarriages. Her uterus became weakened from the first IVF cycle and then couldn't even retain the second pregnancy. So now I have to work with natural herbal therapies and even foods, diet changes of things that they need to bring into the body to strengthen and balance. With the woman, strengthen those uterine walls, unblock the fallopian tubes, make sure that her eggs are producing the eggs that they should, make sure that she's not taking painkillers during her period every month, because she gets cramps every month. I also discuss luteinized follicle syndrome, which is something that sets in when a woman is taking ibuprofen every single month for menstrual cramps. And many women don't take into account that that's something that is very detrimental to fertility. If I'm dealing with a woman that has uterine fibroids or has endometriosis, hormonal imbalances that are these challenges are caused by hormonal imbalance like estrogen dominance. Again, I'm comprising a natural herbal therapy program and making diet changes and lifestyle changes to make sure that we correct that hormonal balance so that she is fertile. So many things with the man, if he has low testosterone, bringing in herbal therapies and changing his diet to where he has that high level of good testosterone and good balance, not too much estrogen in him, so that he can help her with conception. It's all of that is entailed. And I share all of those aspects in here.
Yeah, I love that. I love that. I love the fact that, once they've gone through IVF, that there is still hope there to where they can conceive naturally. I love the fact that you've been able to help couples successfully have children in a natural way. As we are winding tonight's conversation up, let's talk about some of the things that the couple must do in order to have a successful birth. What are some of the things that you're sharing with the couples that they need to do prepare?
Successful birth. So in other words, helping to carry the woman to full term. Is that the question?
Yes.
Okay. So I even discussed that, how there are certain foods that she needs to. So after they've conceived, great. I also work and continue to work with her through those 9 months to make sure that we, again, as we were stating, have her carry to full term, making sure that she's not intaking certain foods that may bring high levels of mercury into the body that can cause neural tube defects, making sure that her stress levels are low, Kathy. Oh, how I want my ladies to be so stress-free as much as possible. Even explaining on a loving spiritual level how not to allow everyone to come to them with negative news and things of that sort, because baby absorbs everything. After baby's in that house, what I call the house, that womb, that beautiful center of core of her body, baby absorbs, feels, hears everything.
Yeah.
And so all love and affection, I require that husband, even if he's not a husband, her partner, be very affectionate and loving, that there's always touching, even if there's not a lot of intimacy, because I do recommend in the first 3 months for them to refrain a bit from intercourse. After 3 months, it's considered kind of like the safe zone where that's a good thing. And I do recommend that they definitely continue to be sexual. Tell them to wait those first 3 months. But once I know that a woman has conceived, there are also little tips that I recommend. I don't recommend that she mop. I don't recommend that she vacuum, because when we do those types of acts, we tend to clench our pelvic muscles, and I want that to be loose. I don't want her to clench and suck in her stomach and any of those things. Housework would be light things like dishes and things of that sort. I recommend them not to do strenuous exercise in the first 3 months. So the first 3 months for me, when she does become pregnant, are crucial. She's to literally baby herself.
Yes.
She's literally, and my patients can tell you that I tell them, okay, it's time for you now to baby yourself. And with the husband there in the consult, by the way, she cannot mop, she can't sweep for the next 3 months. And he's just okay. She can do dishes, she can iron, but that's about it. Yeah. Anything that's stress-free. She's now not to rush in the mornings. I say, if you're used to waking up at 6:30, well, now you're going to take it easier and wake up 15 minutes earlier. Little things like that, because those first 3 months, again, are crucial. I don't want her to miscarry again. She needs to carry full term. That's that. I love for them to incorporate light exercise after the 3 months. I like for my pregnant girls to only look pregnant from the front, not from behind. So baby will absorb everything. And during those 9 months, I put them on a natural herbal prenatal. I don't recommend the chemical prescribed ones. And I tell them, bring this to your conventional gynecologist, your conventional doctor. I'll work together with him or her so that they know what you're using. And I don't like them to take the prescription prenatals because many of them contain certain chemicals and alum sometimes that causes them to have the morning sickness that they shouldn't be having.
Mm-hmm.
And so on. So we want baby to have everything as natural and as pure as possible.
I love it. Love it. I love it. Well, Dr. Julissa, this has been an amazing conversation. Thank you so much for sharing in vitro with us this evening. I am sure that the men and women of Source Nation appreciates it as well. I know I normally do something at the very beginning. I get you to introduce yourself. I was excited about tonight's conversation, so I do apologize. But if you will, just share with Source Nation and everyone watching tonight here on SRN Live Television a little bit about you, and then we'll close the show.
Thank you so much. Well, I am Dr. Julissa Hernandez, naturopathic doctor, practicing now for 23 years. As of May 1st, 2018, opened my first practice in May 1st, 1995, and honored to be here on Source Radio Network. And a teacher of natural medicine and international speaker of natural medicine, radio and television personality, and also very well known for being on the nationally syndicated radio show, The Michael Baisden Show, when it was live and on for its 9 years as their resident naturopathic doctor, and then honored to have been picked up by Kathy and be now your resident naturopathic doctor. Yeah. And I'm honored to be on this health journey with all of you. Thank you,
Awesome.
Kathy.
Well, Dr. Julissa, again, thank you so much. And of course, we always end our conversations either with a tip or maybe some advice that we have not shared in tonight's conversation. If you wish to contribute, would love for you to do so at this time.
Okay, wonderful. Thank you, Kathy. Many aspects regarding fertility are gone blindly by couples. Even your occupation can be a factor with regards to your fertility. And I do share those tips and insights as well here. Everything that you could imagine has been untouched or undiscussed with regards to fertility. And you can all find my information and my new book at drjulissa.com. That's drjulissa.com in English and Spanish editions, on Amazon, The Naturopathic Approach to Fertility. And please know that I am always working with even long distance patients via Skype, Facebook Messenger video, or phone consult. If you desire for me to take this baby journey with you, it would be an honor for me to do so. So reach out to my office and I'm at your service.
Awesome. Dr. Julissa, again, thank you so much for being here tonight and definitely giving us some wonderful and great information in reference to in vitro. Tonight's conversation was definitely needed, and thank you so much. We look forward to having you back here in the studio again next week. Be blessed.
Be blessed. Bye-bye. Thank you.
Well, Source Nation, you heard it right there from Dr. Julissa Hernandez. Of course, tonight's conversation was all about in vitro. For more information on Dr. Julissa, you definitely can go out to Kathy B, SRN Live Television, which is our main station page, SRN Live Television, and tune in every single Thursday for more important information. Again, the book that we spoke from tonight is Dr. Julissa's book, which is a naturopathic approach to fertility. Pick it up. Great information there. Guys, thank you again for watching us. We'll be back here next week for more great conversations and dynamic information to share. Have a great evening. Be blessed.
Get at me for beats, yo.